My own research looks at symptom management in multiple sclerosis. I'm particularly interested in cognition and psychological well-being. The latest project that we have is one that's funded by the NIHR. It's a project called Neuropsychological Evaluation and Rehabilitation in MS, called NEUROMS for short. And it's a 6-year project that is looking at developing cognitive screening and rehabilitation for people with multiple sclerosis. The context of this project is that approximately 70% of people with multiple sclerosis have cognitive problems. This includes problems like memory, attention, concentration, problem solving, which have an important consequence in people's daily lives. Including their ability to continue working or continue with their education. And at the moment, routine cognitive screening on NHS, in NHS clinics doesn't really happen. So what we're trying to do is to enable routine cognitive screening to happen so that we can identify people who have cognitive problems and we're able to provide them with the suitable level of rehabilitation to enable them to work through some of these cognitive problems. One novel aspect of our NEUROMS project is that the cognitive screening that we're developing is going to be delivered online on people's smartphones and on their tablets, so they can do it themselves at home if they choose to do that. We recognize that not everybody can do this themselves, maybe because of their mobility or dexterity problems, or because they don't like using their mobile phones, or they can't use their mobile phones. But for this group of people, we will see them in the clinics and support them through the process of completing their cognitive screening. But ultimately, what we're hoping is that the cognitive screening results will be in front of the neurologists or the MS nurse specialists so that they can make an informed decision as to how to best signpost people or refer people on for the appropriate kind of therapies that they require to deal with their cognitive problems. We're very keen to ensure that the work that we do has a direct impact in terms of patient benefit. One thing that a lot of these kind of studies have been criticized about in the past is that it takes an awful lot of time for us to translate the work that we do from a research perspective to the actual clinical delivery. And in fact, there's some evidence to show that this kind of work can sometimes take up to 17 years from the time it's proven to be effective in research, from research studies. So one way in which we're hoping to close this gap is to work with implementation scientists right from the start. So although the project's just begun and we've got 6 years to go, we're already identifying what could be potential barriers or facilitators to implementing this within the NHS. So 6 years from now, when we've completed the study, we're not going to take another 6 years to actually go down the implementation route because we'd have already ironed out some of the problems. So we hope that it's going to be seamless from the time we've hopefully found effective interventions to support people with these cognitive problems to actually delivering them on the NHS.